everyone. This is the next part in my series all about fat, and this video is cholesterol 101. So the basics of cholesterol and what to look for if you have high cholesterol, as well as the 6 top reasons why you might have high cholesterol and they aren't diet related. So 20 to 40% of our total body cholesterol is from dietary sources. 60 to 80% of our total body cholesterol is made in our liver. If we decrease our cholesterol consumption, our body actually produces more cholesterol to maintain this homeostasis. And if we eat a lot of cholesterol, then our body starts to decrease its own production of cholesterol to maintain the balance. Cholesterol is needed for every single cell membrane. So every single cell membrane has a cholesterol component to it. So whenever there is any damage or your body is in need of repair or your cells are replicating, then the body needs to send out cholesterol there to help with the construction of the cell. LDL and HDL are lipoproteins. So LDL stands for low density lipoprotein and HDL stands for high density lipoprotein. And these lipoproteins are carrier molecules. So they don't just carry cholesterol, they actually carry triglycerides, vitamins, as well as antioxidants as well. And many people tend to view LDL as the bad cholesterol and HDL as the good cholesterol, but that's not really true, and it's not a very accurate way to look at things. So LDL's job is to carry cholesterol from the liver out into the body where it's needed for repair or there's damage there. Common reason is that there's inflammation. And HDL's job is to bring cholesterol back to the liver to be recycled. So as you can see, one's not necessarily better than the other. We need both of them, but we need both of them in a certain ratio. So we want an even number of HDL bringing cholesterol back to the liver as we need LDL bringing cholesterol out into the body. So as I mentioned in my last video all about refined carbs and sugar, if you have a diet that is poor, low in fiber, high in sugar and carbs, then you tend to have a gut dysbiosis. And this is because you are feeding the less beneficial bacteria and you tend to starve the beneficial bacteria if your diet's low in fiber and it's high in refined carbs and sugar. So what happens is that we get a breakdown in the barrier between the inside of our gut and the outside. And this means that things from the inside of our gut can get out into our bloodstream. And this is how autoimmune diseases are hypothesized to start. And we can also get things from the outside of our gut inside. So 70% of our immune cells are on the outside of our gut, and this is because we can easily eat something that's pathogenic and we need to have a lot of defenses there in case that happens. But when we have a diet that's poor and we have a gut dysbiosis and we have a permeability to the lining of our gut, then our immune system tends to attack the bacteria that's inside of our gut. This causes a whole host of issues. Mainly, you're going to feel really lethargic, you're going to have low energy, your brain's going to be foggy, hard to concentrate and focus, and your immunity is going to be much lower, so you're going to get sick often. All of this can be caused by a poor diet, resulting in gut dysbiosis. But what happens is that we have chronic inflammation when that happens. Our immune cells are constantly attacking the inside of our gut and they are secreting inflammatory cytokines, which kind of start this cascade of what we call inflammation. And when we have a lot of inflammation, we tend to increase our LDL cholesterol because we want to bring more cholesterol and other things, because it doesn't just carry cholesterol, but we want to carry more things out to the area where there is inflammation to try to clean things up and fix the problem. So this is a reason why a diet that's high in refined carbs and sugar can actually increase your LDL numbers. So if you go to your doctor and you get your blood tested and it comes back that you have high cholesterol, typically what happens is that the doctor tells you to maybe change your diet and your lifestyle. They might try that first, or they might just put you on a cholesterol lowering drug such as a statin. But what the medical system fails to do is get to the bottom of the situation, the root cause of your high cholesterol. Typically doctors just give a band-aid solution to lower your cholesterol so that when you get your blood tested, it looks fine. But what you really want to do is get to the root cause of your high cholesterol. So there's 6 main causes of high cholesterol, and the first one is metabolic syndrome. Metabolic syndrome is typically caused from being overweight, having a poor, unhealthy lifestyle. Your body is constantly secreting insulin. You may be pre-diabetic. You can have high blood pressure. So this can cause high cholesterol. The second one is genetically high cholesterol. So you have familial hypocholesterolemia. This is when you just genetically are predisposed to having high cholesterol. About 1 in 300 or 1 in 500 people have genetically high cholesterol. If you want to really get to the bottom of that, you can always get your genetics tested. From one place to do it is 23andMe, and just to see if you have that gene that predisposes you to having high cholesterol, if you suspect that's your issue. Another cause of high cholesterol is an infection like an H. pylori infection in your stomach, or a latent viral infection. So there are certain viruses that once we ingest them, once we get them in our body, we can never get rid of them. And an example of this is the cold sore virus. You get it one time and then maybe you get rid of your cold sore, but the virus is just dormant within your body. So your cold sores can keep coming back. This can cause high cholesterol as well. You know, not necessarily the virus that causes cold sores, that was just an example, but latent viral infections can cause high cholesterol. As I mentioned, gut dysbiosis and gut permeability is one of the top causes of high cholesterol, as well as poor thyroid function. So if you suspect that you may have a thyroid issue, then I suggest getting further tests to get to the bottom of that. And it's interesting because before we had cholesterol lowering drugs, doctors would actually give thyroid hormone as a way of lowering cholesterol in patients back in the 80s. Another cause is environmental toxins or heavy metals. So an example of this would be maybe you were living in a house with a mold issue, or your office had a mold issue or something like that. But then also there's certain like beauty products that have toxins in them, like parabens, for example. So you want to minimize your environmental toxin and heavy metal exposure, and you can do that by using more natural products around your house, and then also making sure that you don't have mold, for example. So those are the main 6 causes of high cholesterol. So if you have high cholesterol, it's definitely worth it to investigate one of those, or maybe you have a combination of those, but it's definitely worth it to do a deeper dive and to figure out the root cause of it. Now, if you do have a blood test that comes back with high cholesterol, there are a few other questions you need to be asking your doctor. So just knowing that you have high cholesterol doesn't mean that you have a higher chance of developing heart disease. Not at all. You need to look further into the situation to be able to make a statement like that. So the first thing you want to look at is your LDL and HDL ratio. So as I mentioned, LDL brings cholesterol out into the body, HDL brings cholesterol back to the liver. So you want to have basically equal parts of those. So another thing you want to investigate is your LDL particle number. So I want to use an analogy of a highway to show you that the cholesterol and your LDL particle number are 2 different things, and just because you have high cholesterol doesn't mean you necessarily have an issue within your blood vessels. So if you were to look at a highway and the cars on the highway have passengers, just like your bloodstream has LDL particles and cholesterol is like the passenger of the LDL particle. So you can have a highway that has very few cars but a lot of passengers, or you can have a lot of cars with very few passengers. And that's the same in your bloodstream. So you can have a lot of LDL particles with very few cholesterol, or you can have very few LDL particles and a lot of cholesterol. So the 2 are independent of each other. When you have a lot of cars on the highway is something that is going to predict a car accident, but that's independent of the amount of passengers there are. Just like if you look at your bloodstream, if you have a lot of LDL particles, that is going to predict that there may be some LDL particles bumping into the endothelial lining, which is very thin and delicate, and this is a big issue for heart disease and atherosclerosis. But that is independent of how many cholesterol those LDL particles are carrying. So what's most important is that you're looking at your LDL particle number, because it's a better predictor of having some sort of accident in your blood vessels than the actual cholesterol. Again, cholesterol is like the passengers in the car on the highway, and the number of cars on the highway is a better predictor of a car accident than if you were to just look at the total number of passengers. If you have a high number of LDL particles in your bloodstream, then you have a higher chance of there being some damage to your endothelial lining, which is a thin layer of cells around the inside of your blood vessel. This is something that can lead to heart disease and clogged arteries. And then another thing you want to get tested for is Lp(a), and this is the most atherogenic lipoprotein that we know of. So if your number is high, then you definitely know that you have a higher chance of heart disease for sure. But if you have high cholesterol and you have a low number of Lp(a), then you have less to worry about. And these lipid markers are only part of the puzzle. Definitely your family history is going to be really important when looking at your chances of heart disease. There are inflammatory markers that you can look for in your blood. So if you suspect or you're just curious about the amount of inflammation that you have, you can go to your doctor and get a blood test. They'll likely know what to look for inflammation, but some of the things that I would suggest looking for are C-reactive protein, LPL(a)2, oxidized LDL, as well as metabolic markers such as fasting blood glucose, fasting insulin, fasting leptin, post-meal blood sugar, as well as hemoglobin. Other things to consider when looking at your chances of heart disease are your lifestyle. So is it sedentary? Are you active? Are you getting lots of exercise? Also the amount of stress that you have in your day. Obviously a really high stress job or high stress life is going to increase your chances of heart disease. As I mentioned before, gut health is really important, as well as nutritional status. So being deficient in vitamin D tends to increase your chances of heart disease. And then also having too much iron can increase your chance of heart disease, which is interesting because women tend to have a little bit lower iron. We tend to be deficient because of our menstrual cycle, and men tend to have higher iron because they lack a menstrual cycle. And so that's one reason why men have a higher incidence of heart disease. But the three strongest predictors of heart disease are age, hypertension, and cigarette smoking. So if you have high cholesterol, but your LDL and HDL ratio is fine, you don't have a very high LDL particle number or Lp(a) number, and you exercise, you eat well, you tend to have lower stress, maybe it's not common in your family history, then you likely don't need to worry about heart disease. So if you do have high cholesterol, I suggest looking into those top 6 causes and addressing the root cause first. And if you are worried about having heart disease, then definitely, address your diet and your lifestyle. And by diet, I mean reducing your refined carbs and sugar and increasing your fiber. I suggest getting more exercise, really trying to reduce your stress and get more sleep, and also watching your vitamin D and your iron levels. So if you have any questions about cholesterol, you can comment below or contact me and we can discuss it. Otherwise, I'm going to have one final video about just kind of like my overall message, kind of like a recap about fat and cholesterol next week. And until then, have a great week. Leia decided to join us on the couch.